Welcome back to Financial Futures, where we help you navigate the complex world of insurance and financial planning. Today, we're diving into an important topic that could affect millions of Americans: how to protect yourself from potentially crippling medical bills. Specifically, we'll be comparing the worst and best Medicare supplemental plans by examining how they cover the costs associated with lung cancer treatment, which can average $282,000. Stay tuned because this information could save you and your loved ones from financial devastation. Before we get into the comparison, let's first understand why high medical bills are a concern for so many Americans. Health conditions like heart disease, diabetes, and cancer are among the leading causes of these bills. To give you an idea, here are some staggering statistics. Heart disease, $555 billion annually. Diabetes, $245 billion. Cancer, $225 billion. Obesity, $210 billion. Kidney disease, $130 billion. Lung disease, $170 billion. Arthritis, $80 billion. Stroke, $40 billion. Collectively, these conditions cost Americans $1.7 trillion every year. No wonder there's $220 billion in medical debt across the country, much of it held by those 65 and older. For many, medical expenses are the leading cause of bankruptcy. And for those who are Medicare eligible, the impact can be even more severe. Now, let's focus on cancer, the second leading cause of death in America. Lung cancer alone is the leading cause of cancer-related deaths, and the average cost of treatment is $282,000. Whether it's mesothelioma at $150,000, breast cancer at $101,000, or skin cancer at $48,000, cancer treatment is extraordinarily expensive. For today's comparison, we're going to focus specifically on lung cancer treatment to illustrate the differences between Medicare's supplemental plans. Imagine being diagnosed and needing 2 hospital stays and intensive rehabilitation. These are very realistic scenarios that we'll explore. Before we dive into the comparison, let's quickly review how Medicare Parts A and B work. Medicare Part A covers inpatient hospital care, skilled nursing facilities, and hospice care, while Part B covers outpatient services and doctor visits, including surgeons and anesthesiologists. Both parts also cover medications administered in these settings. Part A has a deductible $1,632 this year that you're responsible for each time you're admitted to the hospital during a benefit period. If you're hospitalized multiple times in a year, you'll pay this deductible each time. For longer hospital stays, you could be paying $408 per day in month 3 and $816 per day in months 4 and 5. Skilled nursing facility care is fully covered for the first 20 days, but after that, you're on the hook for $204 per day up to day 100. Part B comes with a smaller annual deductible $240 in 2024, and after that, you're responsible for 20% of the costs for services like doctor visits, surgeries, and outpatient treatments. There's also something called excess charges, which happen when doctors don't accept Medicare's fee schedule as full payment. In those cases, they can charge you up to 15% more, which you'll need to pay out of pocket. Given all these potential out-of-pocket costs, most people opt for a Medicare supplemental plan, also known as Medigap. These plans are sold by private insurance companies and are designed to cover the gaps in original Medicare. There are currently 10 standardized Medigap plans available, each identified by a different letter. While the coverage provided by these plans is standardized, meaning that Plan G from one company is the same as Plan G from another, the premiums, customer service, and rate stability can vary widely between insurers. Let's walk through a hypothetical scenario to see how different Medigap plans would cover a lung cancer treatment costing $282,000. In our scenario, the patient has 2 hospital stays, each requiring the Part A deductible, 30 days in a skilled nursing facility, requiring payment for 10 days at $204 per day. The Part B deductible, which will definitely be met during treatment. One doctor, specifically the surgeon, who charges an excess fee of 15% on a $30,000 surgery, adding $4,500 to the bill. First up is Medigap Plan A. This is the most basic plan available, covering only the essential benefits mandated by Medicare. It will cover the 20% coinsurance for Part B services. It provides additional 365 days of hospital coverage beyond Medicare's limits. But what doesn't it cover? Unfortunately, quite a lot in this scenario. You'll be responsible for both Part A deductibles, $3,264 total. You'll pay the full $2,040 for skilled nursing care. The Part B deductible of $240 is on you. And finally, the $4,500 excess charge from your surgeon. So, with Plan A, you'd be paying $10,044 out of your own pocket. Not ideal, right? Next, let's look at Plan B. It's similar to Plan A, but with one significant difference: it covers the Part A deductible. You're still responsible for skilled nursing, the Part B deductible, and excess charges. With Plan B, your out-of-pocket costs drop to $6,780. Better, but still substantial. Now, let's consider Plan C. There's an important note here: Plan C is only available to those who were eligible for Medicare before January 1, 2020. It covers. With Plan C, you'd only be responsible for the $4,500 in excess charges from your surgeon. That's a significant reduction in your financial burden. Finally, let's look at one of the most comprehensive options available today: Plan G. This plan is similar to Plan C but is available to anyone, regardless of when they became eligible for Medicare. Plan G covers. The only thing it doesn't cover is the Part B deductible. With Plan G, your total out-of-pocket cost would be just $240, making it one of the best options for most people. Let's talk about Plan D. This plan covers 4 of the 6 gaps in Medicare. It will cover your Medicare Part A deductible and skilled nursing facility coinsurance, but leaves you responsible for the Part B deductible and any excess charges. For example, if you have a $282,000 hospital bill, with Plan D, you would be responsible for about $474 out of pocket. Now, let's talk about Plan F, often considered the gold standard of Medicare supplemental plans. It offers complete coverage, meaning if Medicare covers a service, Plan F covers the rest. However, this plan is only available if you started Medicare before January 1, 2020. With Plan F, your out-of-pocket costs for a $282,000 bill would be $0. Plan G is now the most popular choice for new Medicare enrollees. It covers everything that Plan F does, except for the Part B deductible, which is currently $240. So, in the case of a $282,000 hospital bill, your only out-of-pocket cost would be $240. Many people find Plan G to be the best value for their money. Plans K and L offer more limited coverage, but have out-of-pocket maximums to protect you from excessive costs. Plan K covers 50% of most expenses, while Plan L covers 75%. If your out-of-pocket costs reach $7,060 with Plan K or $3,530 with Plan L, the plan will cover 100% of your remaining costs for the year. Plan M offers a balance between coverage and cost. It covers 50% of your Medicare Part A deductible and full coverage for skilled nursing facilities, but leaves you responsible for the Part B deductible and any excess charges. In our $282,000 bill scenario, you would pay around $6,372 out of pocket with Plan M. Finally, Plan N offers solid coverage with lower premiums, but there are some small co-pays to consider. You'll pay up to $20 for doctor visits and $50 for emergency room visits, plus the Part B deductible and any excess charges. In our example, if you had Plan N, your out-of-pocket costs would be approximately $5,040, assuming 15 doctor visits and no emergency room visits. To wrap things up, let's talk about the top 3 Medicare supplemental plans today. Plan G takes the crown for most popular and comprehensive. Plan N is a great choice for those looking to save on premiums while still getting excellent coverage. And if you're eligible, Plan F remains a strong option for those who want full coverage with no out-of-pocket costs. We're here to answer your questions and make sure you choose the best plan for your needs. Don't forget to subscribe to Financial Futures and hit the notification bell so you never miss an update. We're here to help you navigate your financial future with confidence.